In this video, we're going to talk about some tips and tricks about putting in orders for the CCS cases. You can put in brand names instead of the generics and the system will read it, which is really great. So you can type in Zoloft instead of sertraline. You can type in Zofran instead of ondansetron. When you're getting lab values back, there'll be an asterisk if something is abnormal. So you don't have to spend a lot of time on like checking to see if it fits into the normal range. If there's an asterisk, you can just look right there and then move on. If you're typing in a consult, for example, if you're working on a cardiac case, pulmonary case, neurology case, and you want to consult that department, it'll ask you for a reason for why you're consulting. You don't need to give any like very detailed description, or you can just type in something brief and move on. It doesn't really matter too much. And you just need 3 letters at minimum for something to pull up. So like CBC, CMP, for example, or if you're typing in like acetaminophen, you just need to type in, I would type in like 4, so like ACET, or like if you're typing like trichomonas, like TRICH is enough for the system to recognize it. For every case, I would get in a habit of putting in a standard order set for every single patient. So this would give me a good amount of baseline points and also covers a large part of the differential. So I would put in CBC, CMP, pulse ox, EKG, urinalysis, TSH, and glucose for every single patient right off the bat, as well as beta HCG if it's any female reproductive age. In the beginning of the vignette, it'll tell you if the patient is complaining of like nausea or vomiting, so put in Zofran. If they have any pain, give them morphine. And if they have a fever in their vital signs, make sure you start acetaminophen. Additionally, if they have a fever, you want to make sure you culture their blood, urine, and sputum. If the patient is sexually active and you're worried about an STI, make sure you order a chlamydia and gonorrhea DNA probe, HIV, Hep C, Hep B, syphilis, wet mount for bacterial vaginosis, and get trichomonas as well. If you want to get a lumbar puncture on a patient, order a lumbar puncture, but to actually get an analysis of their CSF, you have to order what you want. So I would just type in CSF and all of these will pull up. So then I would click on each of these and then click accept. In the ER setting, or if you're moving someone to the inpatient or ICU unit, make sure you start an IV access and IV fluid. If you're sending a patient for surgery or any sort of procedure, make sure you make them NPO and you also get a PT, PTT, a PT-INR, and type in cross for them, and also start an antibiotic like cefazolin. If you're working on a cardiac related case, I would get a troponin, I would set up a cardiac monitor, chest x-ray and echo might also be helpful. For pulmonary, of course, chest x-ray and ABGs are also very helpful. For a psych-related case, I would start with a tox screen, a blood alcohol level, aspirin level, acetaminophen, tox nomogram. If a patient comes in complaining of like GI issues or diarrhea, I would type in stool and then these orders will come up and I would just go ahead and click all those as well. In the last 2-minute screen, I would put in preventative orders. So here I would also have a standard set for every single patient. I would get in a habit of just typing in counsel. A very large list will come up. So you can go ahead and click things, and this way if you forget something, you'll see it and click it. But otherwise, I would definitely make sure for every single patient to put in counsel, no smoking, alcohol, illegal drugs, safe sex, medication compliance. You can put exercise or reassure, educating them, for example, if they have diabetes, or educating like on cancer diagnosis, putting in a diet if they're like diabetic or they need a high fiber diet, low fat is good as well. Vaccines are a big thing on this screen, so anyone ages of 11 to 26, HPV vaccine, varicella if they're over 50, DTaP is needed every 10 years, pneumococcal, especially if they have any comorbid illnesses like diabetes or heart conditions, influenza for everyone. Some other preventative orders for females specifically, pap smears and mammograms if they're due, colonoscopy, if they're over 45 and every 10 years. And lastly, you can also put referrals in on this screen, so like social work or nutrition, substance use, things like that. I hope this was helpful, and good luck.